7 silent signs of nerve damage every diabetic misses until it's too late. You've done the right things, watched your carbs, stayed active, checked your A1C. But lately, something's been off. A weird burning in your feet or dry patches that never seem to sweat. Maybe you tripped once and thought, that's odd. And here's the terrifying part. Most diabetics don't know. When your nerves start to die, you might not feel it. One man I met had a blister on his heel for 3 days. No pain, no redness. By the time he noticed it, the tissue underneath had already died. He never felt a thing. 2 weeks later, they took his foot. And he told me, what haunts me most isn't the surgery, it's that I didn't know. I had no warning. That's the danger of diabetic nerve damage. It doesn't start with sharp pain, it starts quietly. In this video, I'll show you 7 silent signs of diabetic nerve damage most people miss until it's too late. You'll learn why they happen, how to test yourself at home, and what to do now, while you still can. Don't wait for pain, it might never come. Stay with me. This could be the video that saves your feet. 1. What causes silent nerve damage? Most people think nerve damage starts with pain. But in diabetics, it often starts long before that, with inflammation, oxidative stress, and something called glycation. When your blood sugar stays high, even just a little, glucose doesn't just float around harmlessly. It attaches to proteins and forms advanced glycation end products, or AGEs. These AGEs damage the lining of your small blood vessels, the ones that feed your nerves. Over time, these tiny vessels narrow. The oxygen supply to your nerves drops. And the nerves, especially the longest ones in your body, like those in your feet, start to die off slowly. But here's the part most people, even some doctors, don't realize. Your sensory nerves don't die all at once. They fail in fragments. You lose your ability to feel temperature, but not pressure. Or you feel pain in one toe, but numbness in the other. That's why diabetic nerve damage doesn't feel like pain. It feels like something's off. Like your body is giving you the wrong signals. Or none at all. You might touch hot water and not realize it. You might develop a sore and never feel the warning signs. That's what makes diabetic neuropathy so dangerous. It doesn't announce itself. It just quietly rewires how you feel the world, until one day you don't. So what happens when your nerves start slipping, but you don't feel it? You stop noticing heat, you stop noticing pressure. Eventually, you stop noticing pain altogether. And when pain disappears, danger doesn't. In fact, that's when it gets worse. Because now, you can injure yourself, bleed, or develop an infection, and you'll never feel a thing, until it's already too late. That's why the next part of this video is so critical. I'm going to walk you through 7 silent signs your nerves are in trouble. Signs so subtle, most people miss them completely. But if you catch them early, you can stop the damage, or even reverse it. Let's start with sign number 1. And trust me, it's not what you think. 2. 7 silent signs most diabetics miss. 1. Mild burning sensation with no clear cause. You're sitting down, relaxed, and suddenly your feet feel like they've touched a heating pad. No redness, no actual heat, just a phantom burn. Why it happens? This is an early sign of small fiber neuropathy, where the unmyelinated C fibers that carry temperature and pain information begin misfiring. Instead of signaling damage, they start generating spontaneous, unprovoked firing, fooling your brain into thinking there's heat or danger when there isn't. This is your nervous system's first whisper, and if ignored, it often leads to complete sensory loss over time. That burning feeling, that was your nerves lying to you. But sometimes they don't scream. Sometimes they just confuse you. The next sign, you touch something familiar, and it no longer feels right. 2. Change in texture perception. You touch a towel, it feels off. The softness is still there, but it doesn't register the way it used to. Or maybe metal feels waxy. Wood feels plastic. Your own skin feels foreign. What's going on? This is often due to partial degradation of A-beta fibers, large, myelinated fibers responsible for touch and pressure. When the signal gets distorted, the brain struggles to translate texture. In some patients, this leads to sensory disassociation, where they cut themselves, bump into objects, or even burn their skin without any immediate realization. The worst part? Most chalk it up to, I'm just not paying attention. When your sense of texture fades, you start losing trust in your own body. But the danger isn't just in what you feel, it's in what your skin stops doing. And when your skin can't sweat, it can't protect you. 3. Dry skin or lack of sweat anhidrosis. Have your feet stopped sweating? Or maybe your heels have cracked, even in humid weather? The root cause: damage to autonomic nerve fibers, specifically the postganglionic sympathetic cholinergic neurons, impairs normal sweat gland function. This leads to localized anhidrosis, usually starting in the feet, and without sweat, your skin loses its natural defense barrier. Fungal infections, fissures, cellulitis, ulcers, all become more likely. And when your nerves are already failing, you might not feel the wound forming at all. If you've ever noticed this but brushed it off, let me know in the comments. What did you think it was at first? Athlete's foot? Dry weather? You're not alone, but now you know better. You might think dry skin is just cosmetic, but when your nerves stop talking to your sweat glands, they might also stop talking to your muscles. That twitch in your foot, that cramp in your leg, that's not dehydration, that's a warning. 4. Muscle twitching or subtle cramping. You're lying in bed. Suddenly your calf jerks, not enough to scare you, but enough to make you wonder, and it keeps happening. What's really going on? This is usually due to denervation hypersensitivity, a phenomenon where muscles overreact to acetylcholine due to lack of regular nerve input. It often starts in the intrinsic muscles of the foot or peroneal muscles in the leg. These twitches aren't just annoying, they're your muscles trying to wake up lost nerves. Think of it as the body screaming into silence. So now your muscles twitch. But what if your brain no longer knows where your feet even are? Because when proprioception fades, even standing still becomes a fall risk. All it takes is closing your eyes, and gravity wins. 5. Loss of balance. When closing your eyes, stand with your feet together. Close your eyes. Do you sway? Wobble? Feel unsure? Why it matters. This is called a positive Romberg sign, and it often indicates proprioceptive loss due to degeneration of dorsal column sensory fibers. Your brain depends on 3 systems to maintain balance: visual cues, vestibular system, inner ear, proprioception, nerve input from your joints and feet. When you close your eyes and sway, it suggests your feet are no longer talking to your brain, a classic sign of diabetic sensory neuropathy. Not just aging, not just fatigue, it's your body failing to locate itself in space. But this next one is the most maddening of all. Pain that drifts, moves, disappears, returns. It doesn't follow the rules, and no one can see it but you. 6. Pain that moves or changes without pattern. One day, your big toe aches. The next day, it's your shin. Then nothing for 3 days. Then suddenly a sharp jolt in your arch. You start wondering, is this in my head? No, it's in your nerves. This is classic neuropathic pain migration, often seen in axonal degeneration where different nerve branches fail at different times. Unlike inflammatory or structural pain, neuropathic pain lacks consistency, resists painkillers, and often worsens at night due to reduced distraction and lower endorphin levels. And finally, when everything seems quiet, even soft bedsheets become torture. The lightest touch, a whisper against your skin, feels like fire. That's not sensitivity. That's your nerves rewired to betray you. 7. Sensitivity to light touch, allodynia. Your bedsheet brushes your leg, and it feels like a razor. A light tap on the skin sends a jolt of discomfort. This is allodynia. It occurs when damaged nerve fibers reroute signals incorrectly, so non-painful stimuli are interpreted as pain. In diabetic patients, it's often seen alongside central sensitization, where the spinal cord amplifies incoming signals due to chronic inflammation. If this is happening, your nervous system is no longer protecting you, it's betraying you. Let's pause for a second. Have you experienced any of these? Maybe you didn't even think it was nerve damage until now. Drop the number that hit you hardest in the comments, because naming it is the first step toward stopping it. These signs might sound small, easy to ignore, but together, they form a pattern. And if you don't recognize it now, the next sign might not be silent. It might be the sound of wheels on a wheelchair. 3. How to tell it's diabetes, not something else. What if it's just B12 deficiency or a pinched nerve? Fair questions. Because diabetic neuropathy can mimic many things, but there are key ways to tell if it's really from diabetes. 1. Symmetry. Diabetic neuropathy is usually symmetrical and starts distally, both feet, both hands. If only one side is affected, or symptoms follow a nerve line, think nerve compression or spinal issue. 2. Timing. Symptoms worse in the morning often point to dawn phenomenon, your liver dumping glucose overnight, damaging nerves silently. 3. Glucose response. If tighter blood sugar leads to improvement, even partial, it's likely diabetic. Other causes, like B12 deficiency, alcohol, autoimmune, won't respond to A1C changes. 4. Reflexes and vibration. Loss of ankle reflexes and reduced vibration at the toe, early diabetic damage. Still have reflexes? Then rule out central nervous issues or early B12 loss. 5. Muscle weakness. If weakness comes early, like foot drop, consider something more than diabetes. Maybe CIDP, stroke, or spinal compression. 6. Metformin and B12. If you're on metformin, test your B12. It can drop without symptoms and mimic neuropathy almost exactly. Knowing the difference matters, because diabetic nerve damage is gradual, symmetrical, and sometimes reversible, but only if caught early. Ever had symptoms misdiagnosed or caught something your doctor missed? Share it in the comments. Your story might help someone ask the right question before it's too late. So now you know how to tell if it's really diabetic neuropathy. But here's the question that matters more. What happens if you miss it? What if those subtle signs you dismissed, the numb toe, the dry skin, the balance loss, weren't harmless at all? What if they were the first domino in a chain you can't stop later? Let's talk about what happens next, when nerve damage goes unnoticed. Not in theory, but in the real world, where thousands lose their limbs every week simply because they didn't feel pain. 4. What happens if you ignore it? When peripheral sensation fades, you lose your early warning system. A blister from friction, a pressure point that turns purple. You don't notice because your nociceptors are gone. The skin breaks, local immune defense is impaired due to microvascular ischemia. Bacteria colonize. But there's no pain, no fever, because autonomic nerves are also impaired. Blood flow declines further. Tissue turns necrotic. By the time there's odor, it's already past the line of surgical salvage. This is how 50% of non-traumatic lower limb amputations in diabetics begin. Not with trauma, but with silence. And the greatest tragedy? Most of it is preventable with early recognition and action. Be honest, did you truly know it worked like this? If even part of this shocked you, type "I didn't know" in the comments. Your comment could be the reason someone else avoids amputation. Scary? Yes. But here's the good news. You don't have to wait for a doctor, a test result, or a worst-case scenario. Because the very nerves that are fading can still speak, if you know how to listen. And with just a cotton swab, a spoon, and a toothbrush, you can start checking your own nerves tonight. Let me show you how. 5. Simple at-home tests you can do today. You don't need expensive tools or a clinic to start checking your nerves. In fact, some of the most telling signs can be found right now in your own bedroom or bathroom. 1. Cotton swab test for light touch. Close your eyes. Have someone lightly touch different toes with a cotton swab. Can you tell which toe was touched? Can you feel the direction of the stroke? This tests light touch discrimination, one of the first senses to fade in diabetic peripheral neuropathy. Pro tip: if you misidentify more than 2 out of 10 touches, that's early sensory decline. 2. Temperature test for C fibers. Take a metal spoon, chill one in the fridge, warm the other with your hand or warm water. Close your eyes, tap each foot with both. Can you easily tell hot from cold? If temperature discrimination is dull, it may indicate early small fiber neuropathy, even if your feet still feel normal. 3. Vibration test. For large fiber loss, use an electric toothbrush or vibrating object. Place it on the bony part of your big toe joint. Do you feel the vibration clearly? Does one side feel weaker or shorter than the other? Compare both feet. In diabetic neuropathy, vibration sense typically fades symmetrically and distally. Can't feel vibration? That's often more predictive of foot ulcer risk than blood sugar readings. Professional tests to ask your doctor for. Monofilament test, 10 grams. Pressed gently onto various points on the foot. If you can't feel it in 4 out of 10 spots, neuropathy is present. Vibration threshold testing measures how long and how deeply you can perceive vibration. More sensitive than simple clinical tests and usually covered by Medicare. Thermal threshold test, if available, helps detect small fiber damage before large fiber loss occurs. Try at least one of these tests tonight. And if you notice something odd, even if you're not sure, drop a comment below. Saying it out loud might help you take the next step. And someone else reading your comment might realize they need to test too. Maybe one of those tests made you pause. Maybe you couldn't feel the cotton, or the vibration was faint. And now you're wondering, is it already too late? Here's the truth. Even if the signs are already there, you're not powerless. In fact, what you do next could make the difference between slow decline and steady recovery. Because when it comes to nerve damage, awareness is step 1. Action is step 2, and hope starts right here. 6. Hope and what you can do. If any part of this video made you feel anxious, that's okay. But here's what I want you to remember. Nerve damage is not a death sentence. You don't have to lose sensation. You don't have to live in fear of losing your foot. Studies show that even after symptoms begin, neuropathy can slow down, and in many cases, partially reverse. Here's what the science supports. Tight blood sugar control. Keeping your glucose in range reduces oxidative stress on nerve fibers and gives them a chance to heal. Alpha-lipoic acid, ALA, a powerful antioxidant that improves nerve conduction and reduces burning or tingling. European guidelines already recommend it for diabetic neuropathy. Benfotiamine, vitamin B1 derivative, helps block the formation of advanced glycation end products, a major culprit in nerve damage. 30 minutes of walking daily, not just for cardio. Moderate activity improves nerve perfusion, supports mitochondria, and lowers inflammation. Avoiding alcohol and smoking, both restrict blood flow and accelerate myelin sheath degeneration. Quitting gives your nerves room to breathe again. Jack did all of this. He was 62, already losing vibration sense. 6 months later, he could feel gravel again under his feet. Not 100%, but enough to stay independent. He told me the best time to act was a year ago. The second best time was today. Don't wait for pain, because with diabetic nerve damage, pain isn't the beginning, it's the final warning. What's one thing you're already doing to protect your nerves? Is it walking daily, watching your A1C, taking supplements? Share it in the comments. Your tip might help someone start their journey today. If even one sign today felt familiar, don't just think about it. Write it. Name it. Own it. Type the number in the comments. Even just F3 hit me, or balance has been getting worse. Because when you speak it out loud, you take back control. And when someone else sees your comment, they'll know they're not alone. This could be the most important comment section you ever read or write in. And if you found value in this, hit that subscribe button. Because around here, we don't just survive with diabetes. We fight smart, we heal early, and we protect what matters before it's too late.